Hi, so thanks for the question. So a couple of things. We've diagnosed, 97,000 cases, but from antibody studies that have been done where we check the blood of people who have had blood draws and check it for COVID antibodies, what we can see is that basically what the data shows is for every case we diagnose, there's about 1.5 other people who have also had the disease, they just never got diagnosed, and therefore they weren't reported. So if you take the 97,000 diagnosed cases, multiply that times 2.5, you'll get the number of cases that have probably actually occurred in our community. It gets you about a third. And then for those same antibody studies, we can see the level and type, this is important, the type of immune response that's been encoded. And so we can see the evidence of vaccine-induced immunity for people who have been vaccinated. We can also see disease-induced immunity from people who've had infection. And so when we look at those blood draw data on random samples of adults, this is important, it's adults in Shelby County, we see that 2/3 of people have either been vaccinated or they've had the disease. And only about a third remain at risk for infection and have no antibodies whatsoever. But that number of people is only about the adults. So what we've looked at in terms of children is about 15% of our kids have had COVID, meaning about 85% of our kids are at risk. And when you actually do the numbers, you see that there's an equal number of children at risk to the number of adults at risk remaining in our community. So but in the adults, 1/3 are completely susceptible, and 2/3 have either been vaccinated or they've had infection. So that's where the numbers come from. It comes from antibody studies done at AEL and at the University of Memphis.